Hi, it's Dave here, and in this video we're going to talk about the role of stomach acid in causing or worsening heartburn symptoms. And it's not what you might think. So traditional or conventional wisdom would have us think that, or believe that heartburn and acid reflux would be caused by too much stomach acid, where the stomach acid production is too high. We have an acidic feeling in our esophagus, we have heartburn, it feels like there's too much acid. And so common sense would really suggest that that's what's going on. But the problem is, in most cases, or I wouldn't necessarily say most cases, but in many cases, that is not what is going on. So why, we have to ask ourselves, would Mother Nature have us overproducing stomach acid, which is highly detrimental to our stomach and esophagus because of its high level of acidity? Why would that happen? It makes no sense. And we're going to talk about a little bit more about that in detail just when we go over here to the low stomach acid section. In some cases, stomach acid production can be excessive. There's no doubt about it. H. pylori, in certain cases, can lead to an excessive amount of stomach acid being produced. And it seems to depend on exactly whereabouts in the stomach the H. pylori is living. Is it living at the top of the stomach? Is it living in the middle? Is it living at the bottom? Or is it inhabiting all areas of the stomach? That seems to have a bearing on whether the stomach increases its production of acid or decreases its production of acid. Because in some people, the H. pylori will drive the acid production down. So it's a very individual and very unique thing here. There is a condition called Zollinger-Ellison syndrome where the stomach acid production is too high, and that needs specialist treatment. It is a medical condition that needs to be really looked after by a gastroenterologist. That's quite rare. There's nobody come through our practice doors or who we've spoken with over the years, 10, 11 years now, who has had Zollinger-Ellison syndrome. So my argument is that we're probably in most cases not dealing with too many people who have excessive amounts of stomach acid production. Many of the people we've worked with tend to be in their 40s, 50s, 60s, maybe even the 70s and 80s. So they're growing into the second half of life, middle age and up into older age. And what the research seems to suggest is that as age progresses, as we grow older, the amount or the incidence of heartburn, acid reflux, gastroesophageal reflux disease, whatever term you want to give it, the incidence increases with age. But at the same time, when we look at the studies, stomach acid production decreases with age, as does the production of a whole range of different things in our body. You know, we don't produce more hormones for the most part. You know, we're typically declining in our physiological function with age, whether we like it or not. It doesn't mean we necessarily have to become ill or diseased and not be healthy, but our physiological function, our capacity does decrease with age, whichever way we slice it. So if heartburn and gastroesophageal reflux disease go up with age and stomach acid levels go down with age, how can we be in this position where we associate heartburn and acid reflux symptoms with excessive stomach acid? It doesn't actually make any sense. And so what makes even less sense is when we go to the doctor and we tell the doctor about these symptoms and the doctor just says, you need to take acid blocking medications. We want to block your stomach acid production because clearly you're taking too much. But hang on a minute, doc, I'm 60 years old, 50 years old, 68 years old, whatever. My acid production should be going down. Why would you give me more meds to knock it down even further, especially without testing? Why does nobody bother testing the stomach acid levels before prescribing these drugs? It's a mystery, right? There are some fairly interesting theories around that which involve things such as, well, heartburn medications for many, many decades now have been among the highest selling medications for the pharmaceutical companies. So it doesn't suit the pharmaceutical companies for you to empower yourself to find the underlying cause of the problem, it's much better for you to take those drugs every day, because that's what gives the shareholders in those companies quite a juicy profit. So if we are trying to empower ourselves and figure out what exactly is going on, we've got to consider the possibility that the stomach acid level might actually be too low. And I've worked with dozens of clients, when we improved their stomach acid production, the heartburn and reflux just went away. Okay, so we know for a fact clinically that is an effect. When we have this paradoxical response, I increase the stomach acid levels, the acid reflux goes down. Why might that happen? Well, it's all going back to this idea of the lower esophageal sphincter, which is this trapdoor, if you like, this junction between the esophagus and the stomach. So it should open out when you swallow your food and allow your food to plop down into your stomach, and then it should close down nice and tightly. But if it doesn't close down nice and tightly and it stays open and relaxed, whatever acid is in your stomach, whether that's too much, a normal amount, or even too little, can just splash back up and irritate your esophagus, leading to heartburn. You don't have to have too much acid for that effect to happen. It only takes a tiny drop of acid to irritate the esophagus, right? So what happens? Well, as we grow older, the symptoms of heartburn and reflux seem to increase in their incidence. The stomach acid levels go down. And what happens is the lower esophageal sphincter, among other control mechanisms, is actually pH sensitive. So if the pH is nice and low, if the stomach is very acidic, the lower esophageal sphincter works well. But if there isn't enough acid and the pH starts to come up more towards neutral or alkaline, then the lower esophageal sphincter relaxes, it opens out, and the acid splashes back up. So we grow older, our acid production declines slightly. It might decline significantly if we have things like H. pylori or nutritional deficiencies that affect the stomach acid production, or stress, for example, chronic stress. And then as our stomach acid production declines, the lower esophageal sphincter relaxes, it stays open, the acid splashes back up, causes heartburn and acid reflux. So what do you do in this respect, in this regard? Well, my recommendation is to try and find a doctor who is willing to test the stomach acid. I'm going to put details of how the stomach acid levels can be tested below this video window. And if you want to trial improving or increasing your acid levels, I recommend doing that with the help of somebody who knows what to do. You can use betaine HCl supplements. You can use apple cider vinegar, but it's important to get it right. You need to know how to use them properly so that they don't increase the symptoms and potentially cause more damage. And of course, you can run various digestive function tests, most of them at home, to figure out why the stomach acid levels might have changed. Is it to do with an H. pylori infection? Do you have key nutritional deficiencies in some of the substances like zinc, for example, that are needed to produce stomach acid? All these things can be done. There's no problem in moving through that process. It's all at your fingertips if you want to use it. One final thing I'll say, and I think this is really important. After watching this information, if you are sort of a little bit older, my age or beyond, in your mid-40s or beyond, there's a probability that your stomach acid production is too low, and that's contributing to the heartburn. If you're taking medications, don't stop them. Don't stop them without working with your doctor. We've worked with many people and helped them wean themselves off those medications, things like proton pump inhibitors, for example. And when we wean them off, we have a very special way of doing that, working alongside the doctor to make sure that the stomach is protected against some acid rebound effect that can occur when people stop those drugs too quickly. And so we can get you off those medications, but don't try and do it on your own. Don't do it just on my recommendation in this video. Work with your doctor and alongside somebody who knows how to counteract the nasty effects of those rebound acid secretions when you try to get off them. So I hope this has been helpful. Please read the notes beneath the video window and the extra resources that I've put in there. And I will see you next time when we are actually going to start to talk about what you can do to overcome your heartburn and acid reflux. So I'll see you then. Thank you.